So there are some treatment challenges. Let's talk a little bit about that. I know that obesity is one of the most significant medical conditions right now in our entire population, but yet you've said that less than 1% of patients in the US who could actually benefit from this surgery actually go through with it and have the surgery. Why is that?
That's correct. Morbid obesity is one of the leading causes of mortality, meaning death, and life years lost in our society. It surpassed smoking recently as one of the leading causes of mortality. And yes, unfortunately, nationwide, only 1% of the patients who could benefit from bariatric surgery actually end up having bariatric surgery. And there's multiple reasons as to why that is. One of the biggest reasons is a lack of knowledge of the treatment options. Many people just don't understand that bariatric surgery is something that can help them. Many medical providers don't know that they can refer their patients for bariatric surgery. So this is a job for every bariatric surgeon, every physician in America to improve the knowledge and education of the population in general. And that's what we hope to at least help a little bit here today. Another big problem is the insurance coverage. The vast majority of patients use insurance to pay for all of their medical needs, including bariatric surgery. Unfortunately, bariatric surgery is not covered by all insurance providers. And when it is covered by some providers, the requirements are very, very high in terms of the medical comorbidities that patients need that many people don't qualify. Finally, some employers don't purchase the bariatric option for their insurance coverage. So even if your overall insurance provider offered it, that individual may not have coverage. And that's a big problem that we see. And again, that's a big issue for everyone in America to work on. We also see that there's problems with lack of access. There are many people who don't live near a bariatric provider, even if they have coverage. And so it just is very difficult for them to go through a program. We try to help with that by offering telehealth visits to patients who are remote from us, who are out of town. And we do everything to facilitate having all their testing and their preoperative workup locally to them or by telehealth. But again, that's a big issue that hinders a lot of people. All those things together, and this is the result, only 1% of the population who would benefit actually has surgery.
And I would think that one of the biggest hurdles would be that cost. You know, it just sounds like something that would be so expensive, but you know, as your patients have told you, you know, they've made it work. Their insurance has either helped them out or there have been other options that have helped them. So it's definitely worth having a conversation with you before making a decision whether that, yes, this is for me or no, it's not for me.
Right. Yeah, and absolutely. There are out-of-pocket costs as well. However, literature shows, and we've found in our own experience, that patients actually save money. For example, when you get rid of your diabetes medications and you don't have them for the next 10 years, when you get rid of your high blood pressure medications, when you're not needing to service or get a CPAP machine or exchange masks or anything like that. Also, we find that patients who are morbidly obese and undergo surgery have lower costs in terms of management of their other medical conditions. They have less emergency room visits, less hospitalizations. Furthermore, employers save money. It's less expensive to insure patients when they're no longer morbidly obese and don't have diabetes, sleep apnea, et cetera. And insurance providers save money too when you're not paying for all these items as well. So it is an upfront cost, but all of the data shows that you recoup a lot of the benefits. And I think many people would say that the way they feel after surgery, being able to do things they otherwise couldn't do, has some value too, could even be considered priceless.
Absolutely. And those are really good points, because I would have not thought of or looked at it from that perspective. Oh, I'm going to save money on this medication and I'm not going to end up, you know, needing this medication or the CPAP machine. I mean, there's costs in everything. So it's a matter of choosing which cost you want to have in your life, I guess.
That's right.